My presentation is entitled Economic Inequalities Caused by COVID-19 and Associated Public Health Measures. This, as you can see, is a joint project together with Klaus Wälde, where both of us are associated with the Johannes Gutenberg University in Mainz, as well as the Labor Research Institute ITSA, and Klaus also holds a research fellowship for the CES-IFO Institute. So let me jump in by pretty much say that this is still a lot of work in progress due to various teaching duties and the pandemic itself. We appreciate every comment on this. Yeah, COVID-19 pandemic causes disruptions which are unparalleled, at least since the Second World War. These disruptions, they concern public health, they concern the economy, but they also concern mental well-being and a lot of other things. And what's interesting about this is that these disruptions are unequally distributed, so they affect individuals differently. We want to focus here on the economic impact, especially when it comes to changes in individual decisions and public health measures in the light of an infectious disease such as COVID-19. So our framework for this presentation will be an equilibrium model with two sectors, J. We look at one period here. Firms, they produce sectoral output, Yj. Our individuals, or the individuals in our model, they derive expected utility from consumption, different type of leisure and stochastic health. They work in different sectors, receive labor income they will use for consumption, obviously, and they are immobile across sectors. So once attached to a certain production sector, individuals cannot move out of this sector. And individuals are endowed with time, which they can allocate freely between leisure activities and also use for labor supply. A first novelty, I would say, is that some activities require leisure time only, whereas some activities require leisure time and consumption, such as, for instance, going to a restaurant takes on leisure time, but in the actual consumption is then the food you eat. This is what we picture when saying it requires leisure time and consumption. And we will have a heterogeneous infection risk, QJ, which is also sector dependent. And we have here public health measures which are issued by the government to reduce contact rates. We will go on the latter two bullet points in greater detail when we come to the model. Let me quickly go over the contribution and findings. We use a standard consumption leisure approach, which is used in various papers throughout the whole year. However, we explicitly distinguish infection risks for consumption and leisure, and also within certain consumption goods or consumption activities, and also within certain leisure activities. We describe the impact of public health measure, where it's regardless whether we're talking about lockdowns, face masks, social distancing, because they all have the same goal in common, namely to reduce contacts, right? So what we provide is some sort of general results on an individual as well as an aggregate outcome when it comes to public health measures. From our model, you will see also an as well as ambiguity of health risks in certain areas. However, they are directly visible, which is quite a nice feature. What we also find is that wages are not necessarily pro-cyclical, as one might suggest or one might guess, with sectoral output. And we find a positive labor supply shock when imposing public health measures on leisure activities. Not all of this will be shown today due to the time constraint, but I will do my best to give a great intuition. Now our model, we have obviously firms, we have one factor of production, labor. Output of sector J is described by a linear production function, equation number 1, where Yj is the sectoral output, AJH is the productivity of workers, and HJ is the total hours demanded by the firms in that sector and are then used for production. A household is described by an instantaneous utility function, where you can already see that we use a Cobb-Douglas structure, and that households are that we look at households who are employed in sector J. Utility comes from two consumption goods / activities. I will use these two terms interchangeably. And here we have two leisure activities as well as the utility from being healthy. The elasticities are all strictly positive, and heterogeneity again comes from the sectoral attachment. Traditional budget constraint, we have expenditure on the left-hand side, and on the right-hand side, we have income, which is described by the total time endowment, L bar, minus the two leisure activities, which constitutes labor supply, and this is then multiplied with wage, culminating in income. And then we come to the health aspect, which is the novelty in these standard consumption leisure approaches. We have a risk of infection that affects utility through health level S. We have a probability in our model of staying healthy, Q, where Q, as you can see here, is also in a similar or traditional Cobb-Douglas structure, where the infection itself comes from contacts an individual will encounter when consuming good 1 or when spending time at leisure activity 2. And these contacts occur according to certain contact rates, right? And these contact rates obviously differ between consumption, leisure, and also labor supply. And what we can see immediately is that we have here the elasticities, which are negative. So once you increase the intensity of consuming activity or good 1, this will lower the probability of staying healthy by beta 1Q%. This is how we view things here. And then we have also a government, obviously, because the government introduces then or issues various public health measures, and we focus on 2. Contact rules, which require face mask, social distancing, quarantines after traveling, and so on. There are a lot more. And this translates in our setting to an alpha here, to a contact rate, which will be fixed. And we also focus on closure, explicitly on closures in the educational sectors, so schools, kindergartens, and so on, which will translate to an exogenous time demand on total time endowment. So this is the general building blocks of our model. We have the individual, we have the firm, we have the health risk, and also the government. Let us now dive into the optimal behavior as well as the equilibrium, and I will also only give a glimpse of that. So households optimally choose consumption, leisure, and working time. What you can see here are closed form solutions for leisure activity K of a household employed in sector J. Similarly, labor supply of a household in sector J, and here it's the optimal consumption of good I of a household employed in sector J. I don't want to go into greater detail here, just want to mention that there are 2 things that all these results have in common, namely this capital delta they all have, and these capital delta describe the difference between, and this can be found down here, the marginal utility compared to the marginal risk of an activity, right? So we have this direct trade-off always here in front, which we can find in every expression, and we have the complete or overall health effect covered by this big psi here. And this is then multiplied with total time endowment. What we see is we have a rather standard macroeconomic structure, which is also quite interesting here, is that It allows us to analyze certain channels by, say, only introducing health risk in leisure activity 1, leisure activity 2, or leisure activity 3. Then only the delta will occur here, but maybe not in consumption, as we make consumption not risk regarding to health. So it allows us to analyze various channels, and you can see that when we model this without any health risk present, where these deltas will vanish, and it will boil down to a standard microeconomic structure where the closed form solutions contain the elasticities only, which is quite a nice feature. When we are in equilibrium, and also this is also just a glimpse of all the results, we focus here on real wages, where in expression 8 we have the real wage coming from the firm's optimization problem, marginal cost equals marginal utility, which is pretty standard. However, we also need to account for the real wage W1 in relation to P2, and vice versa for W2 with respect to P1. Well, why is that? Obviously, individuals in our setup, they can consume not only activity 1 but also activity 2, yet they might are employed in sector 1, which makes the real wage not only W1 over P1 but also W1 over P2. We have the relative wages, GDP, in our model as well. What I want to highlight here is that surprisingly, real wage as well as relative wage only depends or is influenced by the health risk in consumption, but not the health risk in labor supply, which is quite a surprise finding to us. The results from the 2 previous slides, the first 3 bullet points I already mentioned. What is quite interesting is when we focus on relative output, depends on all parameters that affect labor supply. In terms of units, obviously, all sectors jointly expand/shrink whenever labor supply jointly expands or shrinks, which sort of goes back to this expression here as well. I don't want to go into greater detail on this. Let me come to health risk. As I said, health risk was introduced, can be introduced in all activities or certain activities only. So far, we only focused on health risk being present, but not on when an increase occurs. And this is what we do in this section here. We have an increase in infection risk. And here we, for instance, consider labor supply. We also do this for all leisure activities and also consumption activities. But just to give you an idea, we have here labor supply, and see here an increase of the consumption risk of an household employed in sector J. And we do this using, obviously partial derivative, and we can see immediately that when consumption risk increases, labor supply of a household optimally decreases. Similarly, which we also would expect, when risk of infection during work increases, which is captured by this eta JQ, we will find a optimal reduction of labor supply of a household. When it comes to increase in a leisure risk, we find that there is an ambiguous result whether labor supply will increase or decrease, which depends on the marginal utilities, so to speak, of consumption activity 1 and 2 in relation to the health risks associated with consumption 1 and 2, as well as the risk of infection or health risk, if you will, from labor supply. And as I said, we not only do this for labor supply, but for leisure and consumption as well. What's here at play? It's a direct and an indirect effect, which is again captured by these differences here, as well as the overall effect covered by psi.
Niklas.
Yeah.
Niklas, can I just give you the shout?
Yeah.
The 2-minute shout.
It's all right. That's all right. Thank you. Okay. Let me go over this two public health measures also. It won't take too much time, I guess. So when we focus on limiting a leisure activity, which social distancing or restricting certain activities or closing venues such as clubs or whatever has as a goal, what we do in model terms is we put a limit on the activity's contact rate, and we make the the intensity of leisure activity 2, here for instance activity 2, given by an authorized level from the government, which is what we mean by public health measure. Important is that the restriction is binding, such that the optimization problem actually alters, otherwise it wouldn't, and nothing would change. We find that individuals optimally shift resources. When leisure is restricted, which is most common across the globe, time is reallocated to other leisure activities and also labor supply. When we look at shutting down schools and kindergartens, as outlined above, this represents an exogenous time demand and overall time endowment, which will translate to a reduction in leisure time as well as working time. And without compensation, obviously, income as well as consumption of the affected households will decrease. And that's actually already it. We had a canonical consumption leisure approach in this presentation. We captured health risk, individual and equilibrium with implications on individual and equilibrium outcomes. We see health risks of an activity, what happens when they rise to the activity. And we have public health measures in there. Unfortunately, not yet. We're not yet ready to show data on this. I'm very sorry on this because it's still preliminary work, which is also illustrated by the last bullet point. There's still a lot of work to do, but I want to thank you very much for your attention and the possibility to speak to you today. Thank you very much.